Good afternoon, everyone. Now, we would like to invite our next speaker, Mr. Vijayananda J, to deliver his talk on leveraging medical technology, digital health, and seamless integration in ensuring quality, affordable healthcare. Mr. Vijayananda has been in the IT industry for over 25 years. He has been working primarily in healthcare domain. He has been spending the last decade in designing approaches for managing huge amounts of data on the cloud and mechanisms to productionize predictive models. His focus has been primarily on medical data and AI. He also guides external partners on how to leverage their data to provide a unified, cross-institutional, longitudinal 360 patient view, enabling data exchange that is multi-vendor. We welcome you, sir. The session will be chaired by Dr. Somu G, Professor, Department of Hospital Administration, KMC Manipal, and Colonel Dr. Vishal Marwa, Principal, Amrita School of Medicine, Kochi. Over to the chair.
Yeah, okay. Good afternoon, all. At the onset, let me thank the organizers for having given me this opportunity to chair this session. Okay. Session. One thing we know that anything and everything that is to be done in the healthcare scenario is centered around patient care. So we have been speaking over so many about health technology and digital health and so many aspects over the last days. And then yes, it's all around related to enhancing the patient care because we need to keep patient at the center of the focus of all these things. So it is relevant that this talk on leveraging medical technology, digital health, and seamless integration to ensuring quality health is the right is a very apt topic. And I now hand over this to for further comments with the co-chair, and then following that the speaker. Hand over this to for further comments with the co-chair, and then following that.
Thank you, Dr. Somu. The topic, as we can see, is very apt and very important in today's scenario. And without wasting any further time, I'll request Mr. Vijayananda to begin his deliberations.
I wanted to give a brief about the digital transformation and how the technology is going to help in the overall digital transformation that we are seeing in the healthcare. And from my perspective, there are 4 long-term trends that are driving the digital transformation of healthcare. So the first one is about the aging population and the rise of chronic illness like heart diseases and respiratory conditions. These are shifting care to networked, lower cost settings and the home, of course. And the chronic diseases is so prevalent now that 1 in 3 people worldwide suffers from multiple chronic conditions. It could be diabetes, hypertension, heart failure, COPD. Not only these diseases severely impair the quality of life for those affected, they put a heavy burden on our health system too. If I just take the example of US, not that we don't want to take here, but at least we have the numbers there. It has been estimated that the chronic diseases account for almost 75% of the nation's total US healthcare expenditure. So that's the gravity of the first point, which is the chronic diseases. Then the second one is about the resource constraints. These are also driving the shift to a value-based healthcare, a system that aims to increase access to care and improve patient outcomes at lower cost. And the third thing is also about increasing consumer engagement in their own health, is also creating opportunities to focus more on healthy living and prevention. Because if you can prevent something, you could avoid the next phases like diagnosis, treatment, etc. And these industry trends are fundamentally disrupting the landscape for health technology, challenging the ways that we deliver value to our customers. Customers could be healthcare providers, clinicians, governments, it could be payers, etc. And added to this, I would say the pandemic has also radically changed in a way the rate at which we are adopting the digital health technology has suddenly increased because of also the pandemic. I don't have to explain the telehealth services that have increased manifold, and the virtual collaboration that many people are using today. Even just 2 years back, this was kind of, we thought that it will take a couple of years, 5 years horizon, but this has increased heavily. And this is also one of the things that I'm from Philips, and we did a kind of a survey some time back, just a couple of months back, and the digital transformation at the top of the mind for healthcare leaders. And it clearly shows that all of the healthcare executives are eyeing for a digital transformation in their organization. And it is accelerating again. After this pandemic, it is accelerating a lot. I also want to touch upon the digital transformation from the quadruple aim. I don't have to explain this, but the quadruple aim concept was devised by Dr. Thomas, and it appeared first in the Annals of Family Medicine paper somewhere in 2014. It basically talks about four things. One is improve the population health. The second one is, as a patient, as a consumer, me going through that entire healthcare journey, what is my individual experience of the healthcare? Has it improved? That's the second goal. The third goal is also from the professionals who are there as part of delivering care. We need to also improve the professional experience for those. And of course, the last one is, and of course not the least, is also the lower cost of care, which is reduce the per capita cost of the healthcare delivery. And when we talk about the digital transformation, I would like to say that the digital itself is driving the transformation. Because the medical devices are getting smaller, it is also getting smarter, more portable, with kind of a ubiquitous connectivity, enabling real-time data exchange. And the wearable biosensors, they also allow for more continuous health monitoring. And with the health monitoring systems and portable health devices, healthcare no longer needs to be confined to the hospital or to the doctor office, because people can take an active part in it alongside the professionals. And in order to enable all of this, you definitely need to have some kind of a digital platform and a hospital IT, not just within the hospital, but overarching, to give us the capabilities that we need to connect the people, not only the people, the data, the devices, etc. So I would say that the digital is itself is driving the transformation. And at the same time, the digital transformation is also driving the exponential growth of health data, be it imaging or genomics, pathology. These are kind of huge data guzzlers, I would say. Whereas if you look at, let's say, the a monitoring device next to an ICU in a bed next to the patient, that might be sending small amounts of data. It could be vitals, but then it's a continuous flow. But what I understood from one of the public sites is that by 2025, the healthcare data is expected to grow on an average of around 36% every year. So you could just imagine compounded how much it would be in a couple of years from now. There are also barriers to the digital transformation. And this is again from our own surveys that we did across the globe, where we understood from the CIOs and interviewing many healthcare professionals and providers, a lot needs to be done with respect to the data. Almost half of the problems or the barriers is because of immature data management. And almost 1/3 of it is also not having a good interoperability and data standards. If a device is generating some data, and we see that there is an ecosystem where that particular data is being used for many purposes, for other purposes, by other applications, by other devices, then you need to have an interoperable system. For example, if you have, let's say, MRI scanner from a vendor one, and it generates the data, and if it cannot communicate with, let's say, a PACS or a IT system, and let's say a viewer, an application, a clinical application from a third party, from other vendor, then it is so difficult that the data that gets generated can be used in a way that it is much more meaningful for the clinicians or to the patient themselves. And the third important aspect is also about the training. On one hand, we see that there is a lot of digital push and the transformation, but at the same time, we need to ensure that the right set of people are trained in the right technology. And I kind of hypothesis that the future of the digital health is in these three areas. Of course, there are many, but to me, these three are most important. One is personalized. When I say personalized, it's about, nowadays we know about the precision medicine, right? There is pathology, genomics. You can get to know about the structure of that specific patient who is suffering from a particular disease. So what and how the technology can help in figuring out, given this is the kind of DNA, RNA, the setup of the patient, what is the best treatment that I can provide for this particular patient? That is the personalized aspect. And of course, I mentioned about the connectedness, the interoperability, and the integrated stuff. When I say integrated, I mean integration of the information that is generated by a number of devices, be it in hospital or when the patient comes out of the hospital, there is probably home monitoring or even the Fitbits, many of the devices that the patient or the consumer wears. How do you bring all of these together in an integrated way that you can create that kind of holistic information about the patient that can be used for various decisions? And to me, this is all about a health continuum. We need to take an approach, a holistic approach of healthcare across the health continuum, starting from healthy living and probably getting back to the healthy living. It's kind of a closed loop. And I see that the differentiation between the consumer health and the professional health is also narrowing down now. And in my view, the driving the digital transformation, up until now, I spoke about the needs of digital transformation and what kind of barriers are there. In the subsequent slides, I want to touch upon what are those core enabling areas that would help in the digital transformation journey. And it's not just technology. In the second column here, you see the data and technology. It's not just that. I also mentioned about the quadruple aims, which impacts the people and the experiences. There is also a lot that we need to talk about the governance and trust. This is very, very important given given the data sovereignty and the consent, the privacy, etc. And I think in the last 1.5 years, this has just increased a lot, be it in Europe, India, US, China. You look at any of the regions or countries, a lot of stress has been given to this governance and trust. And the last one is quite important, which is about the partnerships and new business models. So it's not just sufficient that hey, there is a technology provider, there is a vendor, there is a company who can develop a particular solution that can help, let's say, address a disease for a set of patients. But it's also about how do I collaborate in an ecosystem, because one single vendor or one single organization cannot take care of providing a solution in silo. For one reason that I already mentioned, that there is a need to take a holistic approach where the data comes from multiple data sources. Not only that, you need to partner with the rest of them in the ecosystem to provide and aim for those quadruple aims that I mentioned earlier. Let's talk about the first one, which is the need-driven innovation supporting the human care experience. The first one that I mentioned here with respect to the people and experiences. We need to come up with something like I would say human-centered design, because when we talk about a technology push, we need to keep in mind that it is not just about the technology that can help in either diagnosis or treatment, etc. But it's all about how do I make it human centered? What are those gaps or the unmet needs of not just the patients, but also the healthcare professionals and the care providers? The second one is, how do I have a frictionless experience in the entire workflow, be it in hospital workflow or in the out of hospital workflow, including the consumer or the patient daily routine? And the third thing that I also mentioned, one of the barriers previously, was on the training and the education. How can we bring the technology in such a way that we move from, let's say, the hospital care to the towards, let's say, a home care, but at the same time ensure that people who are providing the care get the right amount of upskilling and continuous learning, because there is also always a continuous journey in the technology, and we need to also educate the professionals and care providers. The second pillar is on the data and technology, and I don't have to stress too much in this particular domain. You are all quite aware of it, but I think I would like to bring a couple of important enablers in this. One is, a lot is happening on the smart connected devices, and this diagram, this picture shows about a patient who has gone home, and where there are now technologies available. You put a kind of a sensor attached to the patient for around, let's say, 3 weeks or 4 weeks, soon after the patient is from the hospital and at home. And you collect all the necessary vitals of the patient, so that you kind of monitor remotely as well, even when the patient is sleeping, for example. So the data and technology, we need to look at what kind of technology, especially in the sensors, that we can look at to enable the patient to have a healthy living, especially soon after the patient comes out of the hospital, and ensure that in that overall health continuum that I spoke of, how does the patient come back to the healthy living? The second pillar is on the kind of a digital platform, and I specifically mentioned about the cloud-based digital platform. Of course, it doesn't mean that the hospital IT systems and for many scenarios, the data needs to be present within the hospital as well. But if we really have to connect the data coming from multiple data sources, there is a need to really make it digital and have some kind of a platform where the data is harmonized and available to the solution providers and new propositions that come out of it. We don't want a proposition, a new application, a new product by a vendor who wants to really develop something that is closer to a clinical professional professional, or to a care provider, or to a patient, to really look at how do I assimilate all of this data. If there is a platform, a digital platform that could bring all of this data and make the data available for those vendors who want to focus on developing new applications, new products to the end users, we need to have this kind of a cloud-based digital platform. And the third aspect is also about generating the insights, which means it is not just sufficient that we have the data, but try to see how you can provide some actionable insights, generate actionable insights using the AI technology. And the third pillar was on the governance and trust. And I don't have to talk about the security, privacy. There are any of the solutions that we bring should take care of the security and privacy from that particular region, because nowadays each country have their own policy towards and their approach towards the security and the privacy. We need to ensure that the security and privacy, whatever solution that we develop, should be such that it takes care of the security and privacy from that particular region. And the third aspect is about benefit customers, patients, and society, which means we always need to aim to create the solutions, innovative solutions that benefit our end users, who are the patients, and society as a whole. Which means if we are making use of the personal data, let's say for the personalized treatment that I mentioned earlier, it should be ensuring that it always benefit our patients and society as a whole. And there are quite a few AI principles that I have put here, which I think is quite important. I think the second one is quite important, which is human oversight. What it means is we need to design the solutions, especially AI solutions, to augment and empower people, but with appropriate human supervision. It shouldn't be that, hey, there is some decision that is taken without the oversight of a particular human in that particular workflow. I think the rest of them, robustness, fairness. Fairness is all about how do I develop and validate the solutions that is representative of the target group for the intended use. And because we need to avoid bias or discrimination when those AI algorithms are in use. The fourth pillar is about ecosystem that I mentioned earlier, right? This diagram talks about a very high level view of how an enterprise could enterprise IT and the data needs to be brought in a way that I call it as a space, a data space, and it should be such that it should be possible to work with the other data spaces, because in an ecosystem you need to ensure that your solution can easily work with other ecosystems as well. And there are now IoT clouds. And on the right-hand side, you see that how, let's say, a vendor-specific data space should be such that it can be used by other data spaces, as well it can make use of the data in other space. For example, if, let's say, there is a solution that a particular vendor comes up, it should be possible that without copying that entire data, for example, present in some other space, we should be able to still collaborate in a way that the data is still owned by the other data space, but it should be possible that that data can be used for the solutions that are propositions coming from that specific vendor. Here is another view, my view on how the ecosystems, especially in India. On the right-hand side, you see that if I look at the various care centers, starting from community health workers, the sub-health centers. This is the kind of pyramid, I would say, where the primary, the secondary, and the tertiary levels are divided. And if I look at the on the left-hand side, this is my view of how the data that is being generated at these various levels are made available in primary, secondary, and the tertiary. This relates to these levels that are there. And of course, I don't want to go into the details of what I have drawn here. This is all about how the data can be made available that are captured from the primary levels, primary care centers, to the secondary and the tertiary. Not only that, we need to have some kind of a registry at the national level so that it actually serves three purposes. One is the clinical view, the citizen view, and the research view. The clinical view is for the professionals, because if I can collect the data of, let's say, there are cancer patients and there are treatments that are provided, and we make all of this data available in such a way that the professionals can make use of these data that is available, and figure out what is the best treatment for a particular cohort, or in fact a particular patient as well. Of course, today a lot of literature published in journals, medical journals, etc., are being used. But if we can really make this data available, that will be awesome. The second one is about the citizen view. We need to have some kind of a portal for the patient, for the consumer, to also view his or her own data. And the third is a research view, which is very, very important to ensure that the many of the AI-related applications that are generated, that are created, developed, need a lot of data. And if we can have such kind of registries, national registries, or even state-wise registries, where that kind of data is made available to the right set of people to develop the algorithms, that will go a long way in collaborating in an ecosystem and make it available for the right set of people. I'll go fast now. I'll probably finish in another 2 minutes or 3 minutes. It also this is also about the business model, how the digital age. Earlier we were talking about a capital investment, and now it is moving to an operational model and even the risk share model. How can the care providers or even the patient eventually can pay only based on the outcomes? That will be the okay. Then a couple of examples I want to show. This is about a live virtual collaboration that I see nowadays. Many of the vendors and products they are providing, especially in these COVID times, where we kind of empower the care professionals at the bedside. It doesn't have to be that. This example is a tele-ultrasound example, where a virtual care can help to make expert knowledge more widely available throughout a health network. So there could be a person who is doing this actual ultrasound scan. He or she may not be an expert, but you see that in the figure there is an expert sitting somewhere remotely, helping the care provider to actually understand and really the virtual care possible. And although ultrasound technology is getting easier to operate, but it still requires relatively, to me, a high level of manual skills, especially in more complex clinical cases. The second one is about extending the reach of critical care. A lot of tele-ICUs are another great example of how the virtual care can extend the line of sight of physicians to any hospital in the country, or even across the globe. This is yet another example. The third example is about how do I ensure that clinicians are not overloaded with too much new raw data from, let's say, the EMR or PACS, etc. The abundance of data can be so overwhelming that it actually hinders clinical productivity by making it difficult to prioritize tasks and take critical decisions. So there is a need to figure out how the data that is available, probably in abundance, can be brought in a way that insights are generated from that data and not overburden the care clinicians with all of the raw data. And to me, more and more, the healthcare is moving to home. If you see in the bottom, this is the, probably you're all aware of Dr. Eric Topol. He said this 8 years back. The hospital room of the future will be the bedroom. And I see that more and more, the healthcare, which was confined to the hospital earlier, is moving in various scenarios outside of the hospital. So this is pre-hospital screening, especially in the COVID scenario. They had a lot of, many vendors provided a lot of applications that can do a pre-hospital screening, a post-hospital monitoring after the patient. I just mentioned a couple of minutes back about the post-hospital monitoring, Then there is chronic disease management. There is how we can provide remote care to the elderly people. This is an example of prenatal monitoring for pregnant women, etc. So there are quite a few things that are that the technology can be leveraged to provide healthcare, moving from hospital to the home. And I would like to close by having just two slides on the key takeaways. One of the key takeaways to me is a connected network of virtual and in-person care. This is quite important. The in-person care is, of course, has been there traditionally, but also the virtual care that is going to be there and only increasing in the days to come. And we need to figure out how do we have an efficient care collaboration across the patient journey, not just only when the patient is in the hospital, like for diagnosis or treatment. And data and AI and technology should all come together in a way that you generate actionable insights and not just throw the data towards the clinicians. And in any of the innovation that we do, the patients and the healthcare professionals need to be in the center of the digital transformation. It's not about the technology. You see how the whole idea should be with the patients and the healthcare professionals at the center. How do I provide? How do I build that? How do I leverage the technology in such a way that the needs of the patients and the healthcare professionals are taken care of? This is my last slide. This is I just took it from the just concluded RSNA day before yesterday, where the UCSF gave this talk, and there was a slide that they mentioned about what are today's pain points, and how do I go from here to here towards tomorrow's principles. And you see, the first one is about data-rich action power. This is where I was talking about the clinical, the insights. It should be possible that although there is a lot of data, try to see how all the unmeaningful or useless data can be thrown out. Just take the data, or at least you make sense of that lot of tons of data and make it available in a way that there is action to the care provider. There is also a mention of the siloed care, which is unconnected, fragmented care, and the need to go towards a ecosystem. One of the four pillars that I mentioned earlier. I'll stop here and I'll give it back to the chair. Thanks for providing this opportunity and for the patient hearing.
Thank you
For an excellent presentation. I think all the points were well touched upon, and in fact, what has happened is your last two slides on the key takeaways have really given in, the whole message of the entire thing. And I'm sure that yes, in many other presentations also, the one point that has been stressed upon is to make the patient as well as the healthcare workers as the center for probably to drive the change, right? Now I open the session for question answer sessions. First, those who are on offline, and then after that we can take the online session. If the co-chair has any points to make, can also.
It was a very good talk, Mr. Vijayananda. In fact, one thing I really appreciated was you brought out very well that COVID has changed the paradigm. Actually, what would have taken 5 years has probably happened in a shorter time. I personally experienced that when I was some of my colleagues who were in Noida. There was, when I think this family had, the 3-4 members had COVID. So, they went to meet somebody, then they were not satisfied, even with a physical visit. Then they called me and they took a consultation online from the doctors here in my institute. And they were very happy. And he, in fact, after that, one other officer, same thing happened. So I realized that, the things are changing now. The online consultation is a thing which will, have far-reaching bearing actually. Your
Indeed,
comments?
sir. No, indeed. It is, I mean, you gave a real experience from your side, and then we have also seen that this has really taken us by storm, I would say, especially the COVID and how the virtual care is increasing. Indeed, sir. Thank you.
Can I?
Yes, sir. Yes, sir.
I
I am
request
Dr.
the
Ashish Gupta. A very excellent presentation, Vijayananda, but I am a surgeon by profession. Has the Philips got any product in the pipeline which is, I say, based on context-aware mobile computing for healthcare workers? Because the concept is like in the rapid changing scenario of a patient where the patient condition changes rapidly. Suppose a doctor is taking around in room number 201 on second floor in a multi-story building. He orders a urgent lab test. Then the AI and the GPS systems, they get activated in the context and say urgent means they look for the nearest phlebotomist who may be on the same floor and allocates the job to him automatically through AI. And the other context, there can be two types of contacts. One is contacts which are pre-fed in the system. Other contacts which are need-based, like I feed a contact in case the TLC is more than 10,000, please inform me. Now the sample goes to the lab. The moment the sample is fed, the report is fed in the system, my contacts is activated, and in case the report is higher, is transferred to me. So is there any such type of a combination
Absolutely.
of digital technology combined with the GPS technology and AI together, making a product which is more suitable to healthcare industry?
Absolutely, sir. Absolutely. You brought the right example. In fact, we have at least two solutions towards that. One is called the performance flow capacity solution, which, as you rightly said, if this is about a mobile. First, let me tell you that not just us, sir, any vendor today, they talk about any application that they build, it's always mobile first, and then the applications we ensure that it is there available on the desktop and others, huh? So we do have a solution where you have the live information about the various resources and the assets in the hospital and the patients and their criticality with the risk score, such that a matching towards what resource needs to be allocated for which patient, and if there is an emergency, the case that you mentioned, which of the resources and assets and the rooms and the labs are free in such a way which is closer to where you are looking at or where the patient is, so that the corresponding laboratory or any of the tests, etc., can be done, including the nurse, the intensivist, whoever is available that you ask for is made available. Indeed, there are applications towards that, sir.
Thank you. Thank you.
Excellent presentation, sir, Vijayanand. Lot of insights out of your presentation, sir. Like now, since we all are going for moving from towards transformation, I would like to know that first thing is what kind of infrastructure we require for the hospital in terms of collection of data, robust data, and do we require inside team for developing these technologies? How do you see the trends coming in the future? Because now you are a solution provider to many of the companies. Now you are developing various products which are related to AI-based technologies and futuristic technologies. And on other side, you have a competitive force, like each hospital or each country for that, they are competing in areas of technology dominance. So I would like to know what is the best methods an hospital or whatever the scenario, is it better for a hospital to have in-house team or outsource for technology development or whatever in terms of AI solutions? That is my question.
Yeah. Although your voice was breaking, doctor, but I think I got the gist of what you were talking about. So to me, I don't think there is one single solution or one panacea that I can say how it can work for a particular institution or a care provider, because many of the hospitals, care providers, they are in different levels of maturity in terms of to what extent they have a hospital IT, to what extent they have a central archiving system, etc., etc. But in general, I would say that nowadays, especially given the nature of many of the problems and the challenges that I explained, many of the institutions are looking at a hybrid scenario of how a core set of important information should be present as part of the hospital, but a lot to do with compute, AI can be offloaded to a cloud solution. Because typically what happens is that these AI solutions or SaaS solutions that I mentioned, they usually take a lot of compute power, and it is difficult for a particular hospital to invest in so much of compute resources and IT, given the fact that it's not that all of the resources that you have in the hospital will be used 100% always, right? So it is always good to make use of the cloud in such a way that you have a pay-per-use model. That's what I call that. You pay only for the time that you use those resources. And secondly, from the solution provider, companies like us, they are moving into a cloud-based solution. The simple reason I'll tell you, today, if we sell MRI, ultrasound, etc. Now, if there is an MRI or an ultrasound system in the hospital, we have a global presence. We have installed in thousands of hospitals. But if I have to maintain and upgrade the software that is present in each of the different devices in the various locations, you can just imagine the workforce that is there to support, maintain, etc. Whereas with cloud solutions, what is happening is we put it onto the cloud. We get all the relevant customers on board to the cloud. There is one single version, probably per region, in the cloud, and all the upgrades, etc., will happen even without any of the downtime, etc., etc. So on one hand, the providers are moving to the cloud. On the other hand, it's also cost effective for the care providers to leverage the cloud rather than investing a lot in the on-prem infrastructure. But I would say that it's always a hybrid. For example, if I get, let's say, a stroke patient, I do a CT, and then I have to send the data to the internet and then get the results saying that whether it's a hemorrhage or not. I don't think it's going to work. So there has to be some kind of a minimal infrastructure for all the emergency cases, but still try to see how the data on the cloud and the compute resources on the cloud can be leveraged. And you can reach out to any of the Philips professionals. We have a separate set of people who can help the people like you to liberate the data and what is the best way to make use of the infrastructure in the hospital. There are turnkey projects, provide technical people who can guide you as to how this can be done, Doctor. Thanks for asking that.
Thank you.
On behalf of SASH 2021, we would like to present a memento as a token of gratitude to our speaker, Mr. Vijayananda J, and also to our chairperson of this session, Dr. Somu Ji.
Thank you, sir. Thank you.
And I would request Dr. Yashpal Sharma to present the memento to Colonel Dr. Vishal Marwa.
Now, before moving on to the panel discussion, may I request Dr. Yashpal Sharma sir to hand over the memento to our judges of the poster presentation, Dr. Vidya Jha ma'am and Dr. Merlin ma'am. Now, let's move on to the panel discussion. It's my great privilege to invite Mr. Sumit Behel, Vice President, Global Marketing and Strategy, Amrita Technologies, to deliver his talk on the power of integrated transformative technology in healthcare. Mr. Sumit Behel has extensive experience in online and mobile e-commerce and retention strategy payment methods and customer data management. Mr. Sumit has led e-commerce and marketing groups in various Fortune 500 organizations, including American Airlines and Symantec Corporation. He also served as a board member on the Open Travel Alliance, guiding new innovations and technologies in the travel industry. May I now invite the panel members, Dr. S.K. Jawahar, Additional Professor and Head of the Department, Hospital Administration, AIIMS, Bhubaneswar, Dr. Jan Farooq, Medical Superintendent, SKIMS and Professor of Hospital Administration, Dr. Rohan Monas, Chief Administrative Medical Officer, Kanchur Institute of Medical Science. The moderator for the session will be Dr. Prem Nair, Medical Director, Amrita Institute of Medical Science, Kochi.
A very good afternoon to all of you. Thank you for being here for the panel session. The panel session this afternoon is on the power of integrated transformative technology in healthcare. So we shall begin with Dr. Sumit. If you could introduce the topic to all of us. Most of us here are medical administrators and clinicians, and so it would be nice if you could introduce the panel topic to all of us, and then we can proceed further. Welcome to Dr. S.K. Jawahar and
Thank you, sir. Good
Dr.
afternoon.
Monis, Dr. Farooq, and Dr. J.L. Meena.
Thank you, sir. Very good evening to all of you.
Yeah.
Good evening, Mr. Smith.
Yep. Very good evening, very good afternoon to all of you. Thank you, Dr. Prem, for the introduction. And I am just very thrilled to be with all of you at AIIMS today. Yeah, definitely virtually, not in person. I would have loved to be there in person. I would imagine it's 3:30 in the afternoon on a Sunday. So what I would like all of you and the audience to do as well is to imagine the wonderful virtual background behind me, which is beautiful mountains, cities, whatever you'd like, and a warm cup of coffee in front of you. So with that, hopefully we can perk up for the session, and we'll go from there. So thank you everybody again. And what I would like to talk about, let me just share my screen, is really technology transformation. I think you've heard a lot of that in this session, in these sessions for the past 2 days. And what I would love to do is talk a little bit about, of course, some of the trends, share my thoughts around that, and then also talk about the Amrita Journey. So, of course, I'm part of the Amrita organization, but we'll talk about the Amrita Journey in adopting technology and adopting an EHR system, and then where we are headed in the future as well. So we'll talk through that, and then, of course, open it up for questions. So without further ado, let me just continue. I hope everybody can see my screen.
Yes, we can.
Perfect. So let me quickly run through some of the trends that we are seeing today, or even seeing in the past few years. And very common. I think, this is not specific just to the healthcare industry, but very impactful in healthcare. So we've talked about digital mobile, right? Almost a 40% growth rate among patients and providers in digital apps. I think everybody, all the speakers talked about how almost all companies are providing mobile applications, digital applications for engagement. And mostly patients do want to interact with hospitals, with healthcare providers on digital mobile. IoT is a very, of course, it's been a buzzword for many years, but kind of really coming into work now. The Internet of Things, which means everything is a connected system, right? So you should be able to have a network connect so many devices, so many systems across a hospital. And how do you kind of make sure that that all works, right? So for example, we're talking about things like inventory management, patient safety, staff satisfaction, efficiency in hospitals, all through IoT devices. So again, I'll cover it on a high level now, and we can get into more specifics as we move along. Of course, along the IoT spectrum, you've seen all the explosion of wearable devices that have happened across the world. Right now you have the Google Lens, the Google Glasses, the the Fitbits of the world, all kinds of monitoring devices that are all happening from IoT. And it's interesting if you look at the graphic on the right side. For many of you who are maybe James Bond movie buffs, you can see that you even have sensors embedded into your footwear, into your jewelry, into all kinds of things. And these are all non-invasive sensors that can be used to provide data. Of course, not for spying, but for digital technology, for healthcare technology. Cognitive AI. Again, many people talked about that. So again, AI is not just about, I think most of you understand AI, but it is not just about collecting data, but then trying to figure out a meaningful insight out of that. And then how do you kind of make it learn better and better to do things in a better way? So again, lots of applications. I think the previous speaker spoke about technology in Philips, a lot of radiology applications, a lot of applications across diagnostic applications, many applications of AI. But again, there's a balance that needs to be maintained. And so this is what is happening when you talk about AI or analytics modernization. We always used to talk about the first block, which is descriptive, right? What has happened in the past? I have all this great data in my organization. What does that really tell me? So that's great by itself, but then can we go to the next step and say what will happen, right? So that's all about predictive analytics. Again, it all depends on the level of data, the level of the rules that have been created, the level of cognitive AI that's been implemented. But again, we can get to predictive analytics. Then the next step beyond that is prescriptive, right? So, okay, I know you've told me this is what has happened in the past. This is what I think is going to happen. So based on that, what should I do, right? So this is where your clinical decision support systems come into place. All kinds of ways, recommendation engines come into place, and so on. And then the next one is, which is really, I think we are in an evolving stage there. We are not there quite yet, is cognitive. So once I have enough data, I have enough experience about all the factors that have happened in the past, all the factors that I have done, all the decisions that I've made, then we can have various AI engines and machine learning algorithms learning what we have done in the past, and using this collective intelligence, this collective data sharing, can come up with what should be the most recommended outcome. So this is, kind of the wave of the future that is happening now, but will definitely continue to improve as we go along. One other key area that has happened in healthcare is all about robotics. So, we've talked about, of course, robotic surgeries and all that for a long time now. But what is happening in the next stage of robotics is operational efficiencies, right? So how do you make things, how do you, take tasks that are very manual, very repetitive, and figure out a way to do it, with non-human intervention means. Again, beyond the clinical spectrum also, if you look at hospital operations, this is also a very key component so for example, if you look at in the future, you can even think of a world with self-driving wheelchairs, right? So that is all about robotic technologies built along with, of course, cognitive AI and software solutions. We talk about deep learning a little bit. So deep, how do you define deep learning? It is a little bit different from AI. Deep learning is about kind of getting more and more experiences. So in a typical human life, or in your case, as you go through medical school and you go through so many experiences with patients, you definitely develop, much more cognitive abilities, right? You learn a lot more about all the issues that have happened and then what should be the recommended course of action. So think about that multiplied 1,000,000 billion times, right? Because deep learning is taking the power of your cognitive learning and all of yours. So taking all of that collectively and developing it into a framework. So there's a huge potential for deep learning also that is coming along in the future. So again, how is this all made possible? Because we have really, at the end of the day, we have better computers, right? That's what all this is. So we have great sensors. Earlier, even 10 years ago, 5 years ago, sensors used to cost a lot of money. They, maybe hundreds of dollars for very sensitive sensors. Now, sensors, you can get sensors for 100 rupees or, a few hundred rupees. So it's the Moore's law, the curve of investment to invest in these kinds of technology has really dramatically reduced. I mean, the curve is increased, so the actual cost of these components is dramatically reduced. HPC, high performance computing. We used to talk about supercomputers and all those things many years ago, but now even your regular laptop that you're running with 16 GB RAM and a 1 terabyte SSD drive and an i7 processor. I mean, there's huge computing power available, and if you look at high-end processors, high-end machines that have been built, there's a huge amount of technical crunching that can happen through these servers. So that is what is kind of making all this high-performance computing and AI possible, leading to, of course, inference, automation, and finally insights. So we talk about data mining, right? So this is just another slide that talks a little bit more about, if you think about a typical network in a hospital, it is not just all the data coming inside the hospital from inside, but also everything coming outside. I think some of the speakers talked about, even lead generation systems, right? So you have outside generation of patients that are coming in, they're interacting with you, they're sending you all kinds of details. Then when they become patients of your hospital, there's another set of clinical data outcomes that are created, diagnostic data that is created, surgery data that is created. Then think about all the other data that is coming in the hospital, all your machines, all the equipment, all of those are sending you data. So all of this has to come into kind of a data mining stack. And then what happens is, of course, all of that data is now within your hospital, right? So you better make sure that it's secure. I think we had a wonderful session. I was listening earlier this afternoon to a legal session that is a part of this conference. And they were talking about how hospitals are actually the custodian of the data, right? The actual patient clinical data belongs to the patient. So we have to make sure from an IT system perspective, security has to be a very, very key component of your entire data structure. And then, of course, kind of how do you build all the applications around that? Many of the speakers talked about dashboards, having a view into the data. So all of that is the result of, we've got to do deep dive data mining of clinical data and come up with some level of predictive analysis. So I'll give you one example. I was browsing through several examples in the last few days, and this one really caught my eye. I think many of you may have already, on the medical side, may already know about this. But it's to talk about the power of machine learning around cancer detection, right? So a study was done out of the Harvard the Harvard Medical School around melanoma detection for dermoscopic imaging. And you can see that, the same sample was shown, of course, to various clinicians, was run through different data mining algorithms. And I think the image is getting a little cut off at the end. Let me just see if I can show it here. So screen was getting a little bit cut off, but you could see almost a 95% detection rate from machine learning algorithms compared to only about 84% from a human standpoint. So again, not to say that machine algorithms are definitely better, but just pointing out the power of technology. And again, of course, it is not that technology can be used in isolation. All the recommendations, all the analysis coming out of that has to be viewed by a medical person. And so, but it is a great help as you go along the transformation cycle. So this is where, it's a kind of a humorous thing I wanted to just share. With wireless deep technology, the people in my dreams can send email and faxes to the people in your dreams. So this is where we are headed to. This is what people expect. And so the question for us is, how do we get there? So what does all of this mean for hospitals? This is where the rubber meets the road, right? We've talked about all this great stuff, this great technological advancement that's happening. But, how do we really make sure that we are able to do something with that? So what does it mean for us as hospital administrators, as hospital CIOs, as hospital CMOs, chief operation officers? What does it mean for us? It means that we have a huge problem, right? We have a huge data and IT management problem. Because now think about all the beautiful systems that people have talked about. It sounds amazing, right? But all of these systems generate massive amounts of data. They have massive complexity in the architecture requirements. They have massive complexity in the messaging frameworks that need to be created, in the hospital infrastructure, the technology infrastructure that needs to be created. So there is a lot of complexity that is coming in from these IT systems. So the question for us is, how do we manage it? How do we store it? How do we make sense of it? And then, of course, how do we keep it safe? Then there's another issue, right? The financial cost of this. There's always a financial conundrum in most hospitals. Is there really a benefit to all my expense of IT? I mean, I know many people don't say it out aloud, but that's what many people think about. We are spending so much money on IT. Is it really benefiting me? And you can think about it, in terms of a total cost of ownership, right? So you've got to purchase these systems, you've got to maintain them, you go through several cycles of upgrades, you have to train all your staff in these systems, you have security. I mean, there's a huge amount of expense that goes into that. Of course, on the IT side, we would love to talk about that as an investment, because I think many of the speakers also talked about it is not really that you should do it. I mean, you obviously have to do it. The question is, how do you do it to make the most benefit out of that? But still, the financial issue always exists, because how do you kind of really take the path to a very clean ROI from investing in technology? And then this is a nice quote that I kind of remember sometimes. This is from John Wanamaker from many, many years ago. You can see from the black and white picture. And he talked about this in the context of advertising. He said, half the money I spend on advertising is wasted. The trouble is, I don't know which half, right? And you can very well apply the same logic to technology. Half the money I spend on technology is wasted. The trouble is, I don't know which half. So which is a very true concept, because we are always trying to chase, as hospitals and hospital administrators, we are trying to get to the next level of technology. And again, there is a lot of investment that goes in. Sometimes it's effective depending on how the implementation happens, sometimes not so effective. Then there's another thing. Do I really need all this data, right? Again, for 2 days, we've been talking about beautiful systems, giving you all these analytics, all these reports, all this wonderful data. Do I really need this? Who will make sense of all of this? And I don't even have time to do my daily work. So again, not speaking for all of you, but I'm sure many of you feel like that, right? I mean, even I feel like that many days. I just don't have enough time. I mean, even my daily work, I'm not able to do. And now you're giving me all this data and all these insights, and I'm supposed to make sense out of this. Again, this is another conundrum that all of us go through. Then the other thing that, whenever you are implementing a big IT system, or you're moving to a transformative technology, what happens? What happens is, I think many speakers said that, you just don't take something out of the box and just put it in your hospital, right? You have to optimize your process flows. You have to change established processes sometimes, right? Really? I mean, again, many of the people that have been doing things in a very stable fashion for many years, they have a problem with change, right? Even I think many of us have problems with change. Even I have problems with change many times. But it is a necessity as you're moving towards, creating a new technological framework, transformative technology. There is no doubt that you will have to change some of your process flows. You will have to optimize some of your flows. So again, so I'm talking about all the challenges that hospitals face, that you will face as hospital administrators as you are trying to transform your institutions and take them to the next level in technology. This slide talks about hospital stakeholders. So hospitals are unique animals, right? Or unique institutions. They have lots and lots of stakeholders. They have, of course, everything that it takes to run a hospital internally, the hospital board, the employees, the clinicians, the nurses, hospital staff, administrative staff, all of you administrators. But then we have a lot of external influences as well, right? So it's a fairly regulated framework. So government is involved in this. There are lots of health insurance organizations that we have to deal with. Of course, we have to deal with the comparators, NGOs, and so on. And of course, in all of this, we have to remember that patients have to be the single most central foundation block on which we make our decisions, right? Of course, we have to balance other stakeholders, but we have to make sure that we don't delay the voice of the patient. The voice of the patient is probably key to all the things that we set out to do, right? So having finished kind of talking about I would say kind of new technological directions that the world is moving towards in healthcare, and about what it means for hospitals. Let me talk a little bit about actually implementing such a system and the journey of such a system within Amrita. I will only take about 10 minutes to do that. And so that will give you an insight into how we did it at Amrita and what we are aiming to accomplish as well. This slide talks about a typical framework, everything we want to do in a hospital about, smart care around clinical support, diagnostics. How do we do remote care? How do we do patient information management? Talk about the EMR systems, the billing systems, practice management. How do we do medical device integration? The gentleman from Philips and other folks talked about all this great equipment that is there. How do we get the data integrated into the hospital? And then think about, we talked about clinical stuff, but think about all the non-clinical things, right? We have huge number of assets in the hospital. How do you manage those assets? How do you have, hospitals are very, very big buildings, right? Big campuses. How do you do smart energy management? How do you do sustainability at hospitals and so on? So we will talk about, so this is the foundation on which, Amrita started his journey. And I will just talk a little bit about that. There's a nice visual. You guys are already at AIMS. I can just see the visual picture from a nice, drone picture from upstairs. And then, of course, we have the Faridabad campus also shown at the bottom. So our great hospitals in the Amrita group use a system called the Amrita Hospital Information System, which is the enterprise cloud system built by Amrita Technologies. And as I said, I will just take 5 to 7 minutes to talk about this. So Amrita HIS Enterprise Cloud is a fully integrated, certified healthcare information suite for multi-site healthcare facilities built with deep domain expertise. So it sounds like a nice marketing statement, but really it is what it says. It's, it is what the journey in Amrita was all about. Let us create a system that is going to be very integrated. You don't have to go off and build point solutions. Make sure that it works across the board and make sure that it is very compliant with all the standards. So a little bit about the journey, when the AIMS hospital was built in Kochi in the 90s, after that, a bunch of people were tasked with kind of building this system from the grounds up. And so the unique thing about Amrita's HI system was that it was built within the hospital, within AIMS Kochi itself. It was not built as an outside software company. And it was really built with a huge amount of collaboration with everybody at AIMS. So with all the doctors, all the nursing staff, all the pharmacists, all the radiology staff. So it's a very unique kind of bottoms-up system built from within the guts of the hospital. And of course, as the journey has continued, we got an international patent for the product. We have also, deployed the product in the US market. And so we have all kinds of US certifications for the product. In fact, it was only one of 4 products that was CCHIT certified for inpatient care and then for meaningful use criteria care in the last few years. This is where again, a few slides about the product. So since I talked about the base for Amrita, it was developed inside the Kochi hospital. And so unlike a lot of other systems, what we did was we said the patient has to be the key focus for any IT system. And so as you see in the middle of this picture, the EMR, electronic medical record, or the LHR, the lifetime health record, that is the basic foundation stone around which the entire system has been built. So which means that, we very casually call it the patient MRD number or the UHID number. But if you think about that, every piece of technology, every piece of data in the hospital runs around the patient, right? So it's a patient's appointment, it's the patient's bill, it's the patient utilizing a CT scan, it's the patient utilizing a bed. Everything is kind of task built around a patient framework in this system. And then, of course, all these other systems are built around it, right? So you've got to have billing, we have pharmacy, we have HR, we have financial systems, all of telemedicine. So all of those systems are built around the life story of a patient, which is what we think it makes it a little bit unique. And then, of course, around all of that, we have built a reporting framework, a BI framework, workflow management systems, data systems. There's a fairly technical slide. I won't bore you much with it. Just wanted to put it up to say that, of course, we use a lot of technology frameworks. But what we have done is we have built it in a very a modular fashion. So what that really means is that as technology components change over time, we are able to upgrade the back-end technology without the front-end even knowing about it. So, at the hospital, people may not even be aware that there's a big back-end technology change happening. There's a new, a big database upgrade happening, a big application server upgrade happening. All of those are completely opaque to the final end user, which is great, right? Because the hospital can do what it does best, taking care of patients, and the technology side can be managed, without impacting any of the operations. So what of course happened, I think some of you know this, but what happened once the system was deployed in our Kochi facility, many other hospitals would come and see the system, and then they would say, can we have something like that? And so that is how this entity was formed, called Amrita Technologies, about 15 years ago. And since then, we've obviously been, deploying the system in many hospitals beyond India. We have over 40 implementations in India, and we have a few implementations internationally as well in the US, and so on. And again, this is just a quick smattering of some of the other locations that use it. Of course, other the names, lots of broad spectrum of public hospitals, private hospitals, hospital networks that are using the system. I talked about certification. So we had to, right, when we entered, even from the beginning, our objective was we want to make sure it's a completely internationally certified system. And so we had to get all the certifications for inpatient care across the different international domains. A quick few slides on what it looks like. So it's a completely zero client architecture system. That means completely web-based. You do not need any installation on a laptop. You can, you have 500 users in the hospital today. You move to 2,000 tomorrow. No problem. There's no change required on the hospital side other than buying some new hardware for the infrastructure. It's a very unique, responsive system. And again, just to point out to everybody, especially my friends at AIIMS, this is the what I'm talking about is the new version of the system that has come up, and it is of course in the process of being adopted both at Kochi and Faridabad hospitals. It's 4 o'clock in the afternoon. I thought it would cheer you up. There's a nice cartoon I saw about the doctors talking about what a pain it is to have an EMR system that is not optimized. So clearly, again, you can read this, but just to be clear, this is not our design principle, right? Our design principle is how to make life easy for all of you, easy for administrators, easy for clinicians, easy for surgeons, easy for nursing. So that is really the philosophy behind how we build our systems. And I saw there was a spelling mistake in cartoon as well, so apologies for that. As I talked about the Amrita system, it's a fully user interface, fully responsive user interface. So that means, today you have a 13-inch laptop, tomorrow you have a 21-inch screen, doesn't matter, everything will work based on your form factor of the new device. Or you have a tablet, it'll all work within the framework of that. We have a great reporting framework. So many people talked about the power of BI, the power of predictive analytics. So we have since our Amrita HS is a very fairly well integrated system, that means we are able to collect all the data on the clinical side, on the billing side, on the revenue side, on the finance side, on the patient movement side, and we are able to get all of that and then figure out ways to get insights into that data. Just a quick sample of some revenue analysis dashboarding charts that are part of the system. Again, just giving you a sample to give you the power of what is possible. We have, and many people talk about the deployment of mobile EMR. Again, since Amrita has a completely responsive user interface, it is very easy to work through mobiles. Now, again, I'm showing you the beautiful picture of the world, but all of this takes a lot of things to implement on the hospital side that I should not minimize, right? So it is not that tomorrow you can deploy a system like that and you can just start working on it. You have to have the hospital infrastructure in place. That means there has to be great Wi-Fi available across the hospital. There has to be, for example, there has to be a policy decision. Do you allow people to use their personal mobiles to access clinical data, or will the hospital issue those devices? Which means that then there has to be a system to manage those devices, right? So again, the technology is all there. The question is, as hospital administrators, how do you use it, how do you manage it, how do you make sure it gets to the right people, and how do you really kind of make sure that it doesn't go out of control, right? So again, we talked about queue management. Again, many people are talking about, I think maybe Dr. Robinson in this afternoon spoke about an experience, or maybe another spoke about the experience where they saw patients in their hospitals waiting for almost 45 minutes before they saw a clinician. So all of this can be, of course, mitigated through nice appointment systems, patient messaging systems, through queue management systems at various places. So not just at the OP, but think about your lab counters, think about your IP counters, the admission counters, think about radiology. There are so many applications of queue management that can be adopted across the hospital. Again, it sounds very simple and it sounds that we should be able to do it, but the actual implementation is not so easy, because again, you have to think through lots of cases. So for example, I have put all my patients in a queue, but now what if one of my patients went to get a lab test? Now he has to come back and become a part of the queue again. What if I have a critical patient that has come after a few days and just walked in? What if I have a VIP who just walks in? So all of these use cases has to be kind of thought through, built into the system. And more than that, more than the system, also from a usage perspective, there has to be great training, great implementation that has to happen at the department levels, which is where, that is a role where hospital administrators can think through how you will deploy technology like this. Talk about mobile packs. Again, radiologists are, have these wonderful monitors at their stations, the BARC kind of monitors where they're able to see very high resolution images. Now we have the capability to have high resolution images appear on tablets, on mobiles. And again, this is the power of an integrated technological framework where you're able to take the same data, the test being ordered by the clinician as they're sitting in, with the patient, they order radiology investigation on their laptop or on their mobile, and the patient goes and takes the exam. The results are updated by the radiologist. The report is done, and then the clinician sitting in their own office is able to actually view the actual output from the PACS framework on their desktop itself, and they can view it on mobile as well if they're not on their desk. This is a new evolving concept called smart notes. One of the biggest issues with adoption of EMR systems is I don't want to put the data in, right? That's a common complaint across clinicians. They are very busy people. Obviously, you're seeing lots of patients. You don't have time to enter all the stuff. So we are evolving to the next generation of notes or clinical notes called smart notes, where you just do point and click. The note itself guides you how do you proceed forward. So again, these are new concepts that are coming through clinical through the integration of clinical knowledge and technology leadership. Right, all of this has to be meshed together to come up with some kind of a smart notes framework. Again, this concept is, I would say, in development. But again, look at the power of this. Right, you don't have to keep typing. You don't have to. Even some people say even using voice technology, it's better. But again, it's not as clean as able to have a directed system that takes you through your entire note-taking process. We talk about integrated OT system. There's a handover that happens between patients from ward to OT. There's a totally different set of activities that are happening in OT. There's a pre-OP setup, a post-OP setup. All of that is, of course, built into the Amrita framework. We talked about not just the clinical framework. We have an HR system, we have a financial system, we have an asset management system. So there are all these other systems that have to make a hospital run, which is what is kind of being used in the coaching system. This is a kind of a new product that has happened in the past couple of years, which we are really proud of. It is all about process automation. So this is a completely new framework that was designed and built. And it's a very low-code environment. So what that really means is that you as hospital administrators can define your workflows and they can all be embedded into the HI system. So think about all the things that you're doing manually in your hospitals. For example, even if you take the most basic thing like, I have 5,000 employees and I have an expense reporting system. Maybe I'm doing it in Excel, maybe I'm doing email approvals. Just by using this module, you can just build it on your own. It will take you a few days and you can just be up and running on your own. You can have multi-level approvals. For example, you have purchase systems, right? You may be purchasing very high-end equipment, or you may even be purchasing consumables. Whatever you're doing, there's a purchase cycle. In fact, some hospitals that I have visited, it goes through so many layers and so many people have to sign off on a piece of paper. And many of them just do it without even reading it, right? Because it's just a process. So think about the power of doing that process flow automation through an IT system that you can yourself develop. You don't even need IT to help you much with doing this. So this is something that we are very proud of that has come in the last couple of years. And you can think through all the ways you can process it. Amrita came up with a personal health record system. I think Dr. Meena yesterday talked about the National Digital Health Mission and what Prime Minister Modi ji has recommended that every citizen in India should have a personal health record. Amrita, of course, came up with this maybe 4 or 5 years back. And it is, again, kind of a completely standards-driven, web-based driven system, both with a mobile application and so on. So the power of the Amrita PHR is that you give all the power to the patient, right? So it is not just the patient is entered the Amrita hospital, but tomorrow the patient goes to another hospital or a third hospital. They are able to consolidate all the data into their own account, and of course, it's all cloud built. So being of course, a fast-moving technology organization, we have to make sure that we comply with all of our National Health Mission standards. So we are part of the National Health Stack, and we do participate in all of those initiatives as well. I wanted to take just a few minutes since we are Amrita, and we have over the past 2 years, given the pandemic, given how things have progressed, there have been so many other technological innovations happening across Amrita, including Amrita University, which is what the AIIMS hospitals are also contributing to. The AIIMS medical colleges are also contributing to. Just a couple of these things. This was a product that came out of Amrita. It is then the technology was transferred to a startup company. So this is a kind of assisted wheelchairs, right? It is completely a self-driven wheelchair, completely touch and voice activated, that came out of Amrita University. And as I said, it has been now gone into the commercial sector. So things like this, which are a great boon, again, some technological innovation that helps humanity. That is the basic framework for the guiding principle behind most of Amrita's technologies. Again, talking about the framework, all of the testing was done at our AIIMS hospital. So thank you so much for being a part of this. And it was people with strokes, people with spinal injuries, elderly patients, they were all able to use this very, very seamlessly. This was another innovation. Of course, we are in this COVID mess, and this whole concept of we have huge facilities, there are huge facilities across the world. How do you sanitize all of these things? So another technological innovation that came up called Prabha is about a sanitizer, a UV based sanitizer that was completely indigenously built within Amrita University. Again, has been now transferred to a commercial application. And it is all about, you take this machine and you go into, for example, the conference room that all of you guys are sitting in. This machine can sanitize the entire area in about 15 to 20 minutes. So think about the power of that, and how we can use that to avoid the spread of course, COVID and other diseases as well. This is a new thing that has been coming up, which is about remote ECG monitoring. Again, a wireless based. You can deploy this in rural centers. People can actually deploy it themselves. As long as you have a cell phone connection, the entire ECG can be monitored remotely through some other hospital care facility. We have another bunch of applications around big data analytics, around real-time location tracking systems, and I'll talk a little bit about that. So there's something, there's this whole concept of hospitals are big institutions. Half the time you don't even know where your assets are. Half the time you don't even know where your people are, where patients are, where wheelchairs are, where your beds are, movable beds are. So this is a concept of having something called a tracking application. I think some of our colleagues talked about RFID. This is kind of beyond RFID. It's a ZigBee-based application called RTLS, real-time location tracking. And again, what this does is you can slap it on a person, you can slap it on a machine, on a wheelchair, and you can easily see where all your assets are at any point in time. Again, very, very good concept, but again requires that more infrastructure investment needs to happen on the hospital side. We talk about bedside patient monitoring, right? So imagine getting all of that data that is coming on the patient bedside and ICUs and other systems on your mobile. You don't have to be at the ICU. Think about doctors sitting in their own offices and they're able to track what is happening. So this is able to take that data and move it into a format that can be easily consumed by a typical computer or by mobile devices. Last couple of slides and I'm done. This is talking about asset utilization. So think about all the assets, the heavy engineering equipment that you have, or the MRI machines that you have, CT machines you have. Can the system automatically tell you how long the machine was idle, what the run time was, what the shutdown time was? So all of this can be done through sensors. And again, this has been piloted and again can be deployed across the hospital network. Smart energy management, I think this is a concept again, because now we are moving towards sustainable buildings, green buildings, green campuses. How do we make sure that we are able to do smart energy? That means how do you make sure that you have motion-based sensors that can switch off lights, you have time-based electrical consumption statistics which can allow you to figure out where to generate electricity from, at what time, how do you use your solar deployments and so on. So I will end with that. The last, this is of course my final slide, but talking about compassionate technology adoption towards a brighter future. I think that's what Amrita is all about. That is where the organization and our direction has been for ever since we started, and that's what we aim to go towards the future. So how do we use technology for societal good? How are we able to use applied technology in such a way that it benefits the end user? So I will finish with that, and thank you so much for your patience for listening to me on this wonderful Sunday afternoon. Thank you so much.
Thank you, Sumit. I think we'll open the floor to our panelists. Thank you for that comprehensive overview of what's available in software and hardware, the new hardwares that are coming up at our center. We have a few panelists who are with us. Professor Shakti Gupta is here. No. Dr. S.K. Jawahar.
Yes, sir.
If you could.
Yeah. So at the outset, let me thank AHC and Amrita for coming out with this wonderful conference, and I'm happy to be part of it, though I couldn't attend this conference because of some other prior commitments. I'm in the faggot of this program. I'm able to join. Nice to listen to Mr. Sumit, a comprehensive talk on Amrita's work in this excellent area. And I could see Dr. Prem Nair, Dr. Farooq Jan, Dr. Eshpal, Dr. Misra, Dr. Rohan, and all of you. Greetings from AIMS Bhubaneswar. I just wanted to give a little bit of background on this digital devices, digital healthcare in the last couple of decades. In fact, I was part of the Kerala telemedicine network with the Sri Chitra Tirunal Institute for about 10 years. And later when I migrated to AIMS Bhubaneswar, we had an opportunity to try with this telemedicine network during this COVID pandemic. Suddenly all the OPD services were stopped and patients had to be given the service. So we thought about having a telemedicine network established. But the problem that we faced in Kerala with the Kerala network was the doctors were not willing to go to a particular room to give telemedicine service. That was a major limitation. And the patients were not directly connecting to the doctors. So what we have done is we have just distributed some about 50 mobile tablets to various OPDs and departments, and then started a telemedicine network initially over a WhatsApp calling, which is very much available for the patients who they are all used to WhatsApp, and this was one method we have immediately done. So it was a low-cost telemedicine model that we have started, and later on we developed a Swasthya app, AIMS Swasthya app, and we were able to give till date more than 1.4 lakh teleconsultations over these two platforms. And not only Odisha, throughout India and over the globe, we have patients, and today consulting and also following it up. But what the trend we have observed is when there was a limitation of traveling, people have switched on to this mobile, telemedicine, but later when this transport, when the facilities are available, COVID came down, again it is back to the normal that the number of teleconsultations have come down. So I just want to raise a point here for all of us to say that, though there was a change to a great extent of utilizing the digital devices during the COVID, people are returning to the normal thing. Like, you have seen a lot of digital transactions, but now the transactions over the cash is growing. So this is one challenge that we face and need to discuss, deliberate when we talk about this IT in healthcare and the transformations which is happening. Number two, one boon which has happened, when we were working with the telemedicine in Kerala, there was a problem when there was no legal backup by the government. Because of the COVID pandemic that has happened, and NMC has brought out a beautiful document where we have the telemedicine legally. So this has really given us a lot of platform to work on and to move on. And the third thing is the government has come out with the e-Sanjeevani, which is also going up very well. And a lot of doctors, a lot of patients, a lot of doctors in the periphery, they get benefited out of the service of the specialist. And I also wanted to highlight on the Government of India initiatives on this COVID, when we talked about this integrated healthcare. That has really done a wonderful job where we are able to put in our thoughts in peripheral centers all over India, wherever we are doing it up, and the Aadhaar enabled, and the Government of India is able to consolidate, giving us a trend every day. It's a beautiful platform that we have, and all work with this particular IT in healthcare. And there are two more things I thought I'll just share with you. Number one is the public sector, the issues of workload. When you say that to the doctors that about 350, 400 patients, 500 patients per day entering their data, they are asking for some manpower for help. On the other end, in public sector, to give a lot of manpower for entry is a problem. And though they are all used to the mobiles, though they are used to social media, but when it comes to the health, the entry of the data, there is a resistance. So there is an issue, there is a challenge in changing the mindset of the doctors, and maybe that we may have to think of, it's like, we talk about the Africa today, suddenly we brought out some Omicron variant. And one of the reasons is that the vaccinations are less in Africa. So the point is that the solutions can only be arrived at when we have a ubiquitous distribution of the IT availability throughout. So it cannot happen in silos. So you have some institutions where you can implement IT, cannot happen. We need to have it throughout the country in all the institutions and also part of the curriculum. Then only we can bring in this change in all the institutions. And definitely the Ayushman Bharat Digital Mission, which Government of India has brought in, I think in over a period of time, we should be able to come out with digital platform, digital IDs, the doctors are registered, and then we will have a uniform platform all over the country, and then we should be able to go forward in this particular thing. And let me congratulate Amrita Institute for the wonderful work they have been doing in this IT in healthcare, and also developing a beautiful software, and also to Academy for this wonderful initiative. Thank you very much, and wish you all the very best.
Thank you, Dr. Jawahar. It's a pleasure to meet you again. We go back more than 2 decades, and you have consistently worked hard on this area and developed new modalities. It's good to see you, and fortunately for us, whether we like it or not, COVID-19 has permanently changed the landscape for all of us in the healthcare field. I don't think we will go down too much. We'll continue to surge and build more systems in the telemedicine field.
Thank you, sir.
If we don't, the patients will force us to.
Yes, Dr. Prem. Good evening, everybody. And I'd like to take this opportunity to congratulate AHA and Amrita on hosting such a magnificent show, SASH-2021. And Sumit, that was a fantastic performance. That was a fantastic presentation that we heard from you. Well, at the outset, what's happening is I was working in this digital space most probably like a decade ago. And then post the pandemic, when I just got back to my team, because I had to relocate from Apollo Health City, Hyderabad to Mangalore for personal reasons. And then I just got back to my team. And then they were like, I think, you know what, Rohan, we were like 10 years, we were doing our projects 10 years in advance back then, and people just could not connect to us. So back in the days, that was early 2010, we had like a healthcare with an IT and with a telco, or with a telecom interface. You know, we had to interface all these guys because the network was important. We tied up with Airtel, Aircel, and a couple of other companies. And we had like a very simple, basic medical response center located at Hyderabad. Back in the days, what happened is the medical response center comprised of doctors, nurses, and a few other physical therapy staff. And the phones worked 24/7, right? And this is what happened. This is what happening even till today. Like this was like an NHS kind of a system with the CDSS, which was the back end of NHS Direct, which we had a tie-up with at Apollo, which we got in back then. And talking right now, I mean, I think they've gone into a different space, into drone deliveries and all stuff like that. So when we talk about technology here, it could be like a very dangerous enthusiasm or even like a disruptive innovation. Well, I see it like on a very positive trend. Disruptive innovation is the need of the hour. And Sumit beautifully touched up upon your tele-support system, the telemonitoring, which is everything which is basically patient-centric, right? Now, I just had a couple of questions. Is there something which you guys have also developed into training the medical students, since it's a medical college-based institution?
Yes, we are a medical college-based institution, yes, both here and in Delhi, and we are also a university, a deemed university.
Yes, so my question to Sumit also was, I mean, do we have something called as like a healthcare IT systems in terms of training students? For example, as we speak today, simulation and skills lab has been one of the biggest verticals for institutions, according to the National Medical Commission also. And so we've been actually closely trying to pick up a product which is called as an iSimulate. And very interesting, you can actually create like a trauma center anywhere. It could be roadside, it could be a hospital, it could be a study room, it could be a classroom. And it could be beamed through the Apple TV into any other remote location for like a field-based kind of like a simulation kind of an outcome, where the person attending to the case or the trauma case, which could be modulated at anything, could be a pediatric or a geriatric case, you know, we could actually moderate that and give an outcome. So is Amrita also having a system wherein you have a simulation?
It's a great point. Actually, you know, it's somewhat along the lines of, if you take the next evolution of that, you know, we are talking about VR, like virtual reality.
Yes, virtual reality, yeah.
So yeah, I mean, Amrita per se is doing work in virtual reality. We have built some simulation systems. But we are also potentially collaborating. You know, for example, if I was attending another event a few months back with Microsoft, and you know, they, maybe you've also seen that, but they've kind of built out this whole virtual reality framework. It's still, of course, in beta, where potentially doctors can, you know, correlate and talk to each other and kind of see visual models of what's actually happening, or plan their surgeries and outcomes and so on. So the technology is definitely evolving. You know, we are definitely working towards that, as Dr. Prem mentioned, from a university standpoint and from a research standpoint. We don't really have a product per se yet, but I think we will be going in that direction definitely.
Yeah, probably I think the next phase will be the simulations, and possibly looking forward, maybe leapfrogging a couple of years down the line, maybe these systems with AI, with AR, with deep learning, and with ML probably would help doctors make better decisions. That would be one of the main key point takeaways from your session. And especially diagnosing diseases, because the dependency on these units have become so high these days that this has stopped working. You know, Even we have medical students in the first year. We have basic training parameters like percussion, palpation, or auscultation, everything is just getting electronic and is all becoming lab-based or data-based on the lab. And then, so we got to get into that space very, very interestingly. And I think probably going forward, I think tissue engineering, bioprinting, genetic care, genetic-based disease care, etc. The space is huge, and with big data being playing a very strong game in the healthcare market, in the healthcare space, is going to make an immense contribution.
Absolutely.
Thank you so much, Sunil. Thank you so much. Thank you, Prem sir.
Thank you, Dr. Roshan. Thanks a lot. We'll go back to Dr. Jan Roshan. Dr. Jan Farooq.
But let me tell you, sir, that the healthcare technology has really revolutionized healthcare, and it is now happening even at distant corners of India. If we see what COVID did to us, it has really revolutionized us. And one of the examples was utilization of virtual clinics throughout the whole country, and which definitely helped us to decongest our OPDs. It was because of this technology only. And then we have seen that the instruments, the equipments which we are using, it has been very fruitful in reducing the load on our manpower. You can see the infusion pumps. When your nurse used to run from patient to patient, now she can just customize it and give through the infusion pumps. And then central monitors in our intensive care units, in our high dependency areas, we can centrally monitor the things. And another thing has been utilization of CCTVs. When Supreme Court ordered that CCTVs should be placed inside the COVID areas, when we were monitoring what the staff is doing there, whether staff is available in those areas or not. And another thing is simulations, which we are using. So we can see that simulations we are using in radiotherapy, you are using simulations in OT scheduling, you are using simulations for planning your surgeries. And then there is increasing use of RFIDs in reducing your equipment, the missing of your instruments whilst doing surgeries. And all this has come in a big way. The vaccination, the example of our vaccination, how we produced vaccines to a great extent within short period, less than a year. And India has been able to immunize more than 2.2 billion people. And it is all because of the technology which we have. One thing which we need to see is that, is patient at the center of this technology? Who is driving the technology? The competition between the providers is probably keeping the patient, he is getting benefited because of this competition. We need to see that the costs are kept under control. We need to answer the question, are the costs really decreasing or are the costs increasing? Obviously, when we use information technology, there is less use of manpower. There is no duplication of services. You don't need to repeat your investigations on, and you are reducing the cost. But on the other side, when you are using this equipment like fluid warmers, blood warmers, there is a lot of disposables you have to use. When you are using infusion pumps, dialysis machines, there are a lot of disposables you have to use. So how to keep a control on those things? Because ultimately we have to see whether this cost, this healthcare is affordable or not. Because the definition of primary healthcare is we have to make this cost affordable to all. Another thing is that when we are using these virtual clinics and when we are giving personalized medicine, and then when we are giving medicine through we are dispensing pharmacy through digitization, is the personality, is the physicality lost? Is the physical contact between the patients and the doctors lost? We need to answer these questions. We are seeing that when we are using these Facebooks and we are using other things, Twitter, there is a lot of regulation. But here what is happening, our medical devices are getting the data from our patients, the data, and patients are happily giving them all, they're allowing the data to go there. So then it means that there has to be some regulation while you are using information technology. So I think these 3 to 4 questions I would definitely need to be answered, that we have to keep the patient at the center of this thing. He is the person for which everything has to be done. We have to see how we can keep the costs under control. we are not only increasing the capital costs, we are also increasing the running cost, the operational cost. There we have to see, we have to find out how the physicality, the contact between the doctor and the patient should not be lost, and how to regulate these facilities. Thank you very much.
Thank you, Dr. Farooq. Those were very thoughtful points that you have brought up, and it's important for all of us to think about it and study in our own environment, in our own digital setup, how we are faring in terms of the costs and in terms of the patient care benefit. I'm sure that with the extent of excitement among the medical faculty, we will definitely prove that this is eventually going to be helpful for the patient, who is the ultimate stakeholder. So I thank you all for participating. In view of the lateness of the hour, we'll move on to the valedictory function. Thank you all, sir.
Thank you, Dr. Prem.
Thank you, Dr. Prem. Thank you, Mr. Sumit.
Thank you, everybody on the panel, Dr. Farooq, Dr. Rohan, Dr. Pillai.
On behalf of SASH 2021, we would like to present a memento as a token of gratitude to our speaker, Mr. Sumit Behel, for this session, and also to our panelists for this session. May I request Colonel Dr. Vishal Marwa, sir, to present a memento to Dr. Prem Nair, sir.
To improve the golden moment of opportunity and catch the good that is in our reach is the greatest art of life. A very warm good evening to our guests, delegates, intellectuals, invited guests, professors, students, and ladies and gentlemen. We have come to the final session of the two-day SASH 2021 proceeding with this valedictory program. We start with the release of the special edition of JAHA Journal that carries the conference proceedings. We invite Dr. Yashpal Sharma and Dr. Prem Nair to this dais. I request Dr. Yashpal Sharma to release the journal and present the first copy to Dr. Prem Nair. Thank you all. Now, it's the much awaited event. Yes, time for the declaration of our prize winners. So I request Dr. Vidya Jha to announce the result for the paper, poster, and quiz competitions.
True, this is the most awaited part of the conference. It's hard not to fail, but there is always a chance of success. Of course, there is no chance of success if you don't try. With this, coming on to the first category of winners under the faculty paper presentation, do we have any guesses for our third, second, and first winners? Today, pre-lunch, we had this faculty session. So the third winner is Dr. Shalini and Dr. Kanakvali from JSS Mysore. For the second position, we have Dr. Ruchi Kushwaha from Government Institute of Medical Science, Noida. And the first prize goes to, sir, any guesses, Dr. Ashish, sir? Sir, any guesses?
From my college.
Dr. Sukhbir Singh from PGIMS, Rohtak.
Thank you. First prize declared
for the posters, we had approximately 50 or 55 poster presentations, and of them 10 were shortlisted. And the third prize for poster presentation goes to Dr. Pushpi Rani from Nizam's Institute of Medical Science. Second prize goes to Dr. Lavneesh Tyagi from Armed Forces of Medical Sciences. The first prize goes to Lieutenant Colonel Dr. Akhilesh Upadhyay, again from Armed Forces. Now we move on to quiz competition. And interestingly, we had joint winners and we had a tiebreaker, but all the participants, they did not wanted to have a tiebreaker. They all agreed to be the joint winners. So we have 3 teams as the winners. Ms. Preksha Dadich and Ms. Sania from JSS Academy of Higher Education and Research, Mysore. Dr. Anmol Jain and Dr. Chris Agarwal from King George Medical University. And Dr. Moindrala Halder from Symbiosis Institute of Medical Sciences, Pune. Moving on to the last category of students' paper presentation, the 3rd prize goes to Dr. Nikhila Boma from Nizam's Institute of Medical Sciences. 2nd prize goes to Dr. Alex Tom from KMC Manipal. And any guesses for the 1st prize? The one who presented 4th. So she was Dr. Harshita Balasubramanian, JSS Academy of Higher Education and Research, Mysore. A big thank you to all the participants. You inspire us all. Thank you.
Congratulations for all the winners and participants. Now, again, may I request Dr. Vidya Jha, Associate Professor, Pathology and Assistant Administrator of Amrita Institute of Medical Sciences to deliver the vote of thanks. She was also the Organizing Secretary of SASH-2021. Welcome, ma'am.
Om Amriteshwariye Namaha. On behalf of SASH-2021, our heartfelt thanks to Sampujya Swamiji and Swamini Amma for invoking the blessings of our beloved Amma at the very beginning of this 2 days SASH conference. Today, we are witness to the release of conference proceedings, which highlights the strong strength of our experts in this field, which includes academics, operations, and research in hospital and healthcare. On behalf of SASH 2021, we thank all the esteemed speakers, chairpersons, authors, and participants of various events for actively supporting this conference. Dr. Yashpal Sharma, President of Academy of Hospital Administration, Dr. Anil Gomes, Vice President of AHA, and Dr. Prem Nair Sir, Medical Director, Amrita Hospital, who are veterans in the field of promoting affordable and sustainable healthcare. We thank you, sir, for being the guiding light in the conference and look forward to your guidance and blessings. We also like to thank Dr. Vishal Marwa sir, Principal, Amrita School of Medicine, Dr. Babu Rao sir, Dr. Ashish K. Gupta, and Dr. Paramhans Mishra for all being here and sparing valuable time with us. We take this opportunity to thank all the delegates who had registered, without whom this conference would not achieve this success. A big thank you to all the delegates. I would like to make a special thank you note to Sri Deepak Rai sir for being such a wonderful support behind the screen at AHA office. I'll be failing in my duty if I don't acknowledge the significant role of our lovely and enthusiastic students, our staff and faculty, volunteers, and ashramites in organizing this conference. Thank you very much. Heartfelt thanks to our IT team and AV team for their stupendous work in ensuring seamless transmission and conduct of this virtual conference. Thank you to one and all. Goodbye till we meet again for SASH 2022. Till then, stay safe and stay blessed. Thank you.
We invite Dr. Yashpal Sharma for concluding the session. Please, sir.
Yeah, good evening to each one of you. I think with a vote of thanks, it has already concluded, but I would like to, as I've been requested, I would like to say a few words. With the blessing of Reverend Amma, respected Swamiji, and participation of Dr. Jitendra Singh, Honorable Minister, Dr. Prem Nair, Dr. Professor Dinesh, Dr. Vishal Marwa, Dr. Ashish Mishra, and members from BOE of AHA, Organizing Committee of the SASH 2021, the students and the participants. We have successfully concluded today's program. A big thanks and congratulations to all of you, especially the Amrita Institute and Dr. Dinesh and team. Please give them a big hand. thank the speakers as well as chairperson and co-chairperson. It will be now difficult to name each one of them. What each one of them has done a wonderful job. I must say that this conference was one of the unique conference, virtual as well as physical. And as far as the content and the quality of the presentation was, I think, par excellence, for which the organizers really deserves special appreciation. Congratulations to all those who got prizes for the quiz competition and paper presentation, be it faculty or the students. I'm really very happy, and I congratulate them, and also to those who participated in the various presentations. More than 1,000 delegates, I'm told that they were registered, about 1,134. That's a very big number, and I'm sure that they have been benefited also. Today we have released the proceedings of the conference also. That was also in time. That's a great achievement. Dr. Dinesh, again, you and your team deserves a big applause for that. I'm really very happy. And I will request the people who have presented their papers to send us the scientific articles on the same. We will be very happy to publish a special Jaha edition for the SASH-2021. And we'll be happy to include all those, articles in that. As far as the AHA is concerned, I'll request all of you, the people who are in the management, to please become members of AHS. This is the only professional body. You have the provision for the student membership, for the associate membership, for full lifetime membership. So by that, there are a lot of benefits. We are organizing many training programs. We are organizing many webinars, especially fortnight webinars are going on, which are really very useful. Our presence on the social media platforms is also there. You can follow us on Facebook, on Instagram, on YouTube. All the webinars recently, which are fortnightly held, and these are, you can watch them on YouTube. These are available on YouTube. Very, good and full of content. These webinars are. So I'll request you to please join that also. Then we are shortly trying to run a management development program of AHA for the hospital administrators. So for that, I've already requested Director Saab to please ensure that some of the batches from these institutions are also there, so that we can train them. And as far as the faculty is concerned, you know that AHA has stalwarts of hospital administration. You name any institution, the faculty as well as people from those institutions who are heading the various departments and institutions are part of us. So we are doing a lot of good job in quality, QMS, NQAS, and updation of the NAVH accreditation program is also going on in the AHA. Sir, I will request you to please send some batches or help us in getting your people trained in updates in NAVH. So that is going on 5th edition. We have a program director with us. He has already discussed that with you. We would like a continuous, collaboration or cooperation and continuous support of your institution for the Academy of Hospital Administration. I'm really very happy and very contented to be here, sir. I'm really very thankful to you and for this program of today. I wish you all very good luck. Please be safe and stay safe. Thank you very much. All the best. Thank you.